To everyone, this is Mr. M. Sundaran, Assistant Professor, Department of Agriculture Engineering, working in Kungunadu College of Engineering Technology. In the course of groundwater well engineering, today's topic is about the well maintenance. Next, first is well maintenance versus well disinfection. After the completion of well installation after casing, the pumping well and apparatus like casing, pump, pipe system has to be disinfected and sterilized properly. The chlorinated water prepared by dissolving a dry calcium hypochlorite or liquid sodium hypochlorite or gaseous chlorine in water is most heavily used for this purpose. The solution is poured into the well, thoroughly agitated and allowed to stand for several hours. Then well is flushed to remove the entire disinfecting agent. So it's well maintenance. Well maintenance, regular inspection. Inspect your well at least once a year. Any signs of damage, corrosion or wear or tear. Check the well head, casing, surrounding areas for any cracks, leaks or contaminated sources. Next, water quality testing. Test your well water regularly for contaminants such as bacteria, fungi, nitrates, other pollutants. You can either do this yourself or testing kit, hire professional water testing services. Keep the area clear. Ensure that around the area of well is clear of debris and vegetation and potential contaminants. This includes keeping the chemical, fertilizer, other pollutants away from the well head. Protect the well head. Install a protective cover or cap on the well head to prevent debris, insects, animals from entering the well. Maintain the pump and components. Regularly inspect and maintain the well, pressure pump, pressure tank, and other components of the water system. Check for any leaks, unusual noises, or signs of malfunction. Next, well maintenance and rehabilitation. First, although the expected service of life well depends upon the design and construction and development and operation of the well, proper maintenance of well helps to improve the performance and increase their service life. Proper records for well discharge, drawdown, power consumption, operating hours, and periodic checking of water quality and other such observations are very useful for promoting the proper maintenance and rehabilitation plans. So the well maintenance. In order to ensure the well performance does not deteriorate considerably, the periodic test for the well efficiency should be conducted and then results compared with the values obtained from the well as new. You need to check the values with the comparison of the new well and then currently running well. Check that any difference. The well can be considered maintaining a reasonable performance if the well efficiency does not decline more than 50% from their original value. The ratio of theoretical drawdown to the measured from drawdown of pumping well should be 15%. If more than 50% means it should be well has been some damage. When performance falls below the hospital standard, redevelopment should be considered. As a monitoring of well efficiency is difficult and expensive, specific capacity ratio of discharge drawn pumping well, which is measured by the productivity of pumping well, often to evaluate the performance with time. The seasonal and yearly influence of the pumping well must be also considered. What are the major causes deteriorating the well performance? The performance of the wells can be deteriorated because one or combination of following factors: change in hydrologic conditions leading to declining groundwater levels, excessive pumping of sand causing deterioration on the filter zone, clogging of the filter zone by fine particles, reduction of well discharge and well efficiency due to the incrustation of bacterial growth on well screen or filter zone, degradation of water quality due to contamination, structural damage or well casing or screen due to corrosion or reasons. These are the major reasons causing the deteriorating well performance. Next, well maintenance and rehabilitation techniques. One of the causes of deterioration is well performance is identified. One or more rehabilitation techniques can be effective restoring the specific capacity or discharge in pumping well or protecting the well from further deterioration. Main feature of well is as follows. As a well owner, we should know about the static water level, pumping rate, pumping water level, total well depth, impact of nearby wells. Next, well rehabilitation procedures. Notify all the users surrounding who are using the flash. Determine the characteristics of the well. Remove the pumping mechanism and lifting device. Remove all polluted sediments and debris using jetting method. Remove the damage. And then clean the well physically. Clean the well chemically. Disinfect the well with high strength of calcium hypochlorine. Next one, dewater the well and seal the top of the well. These are the methods used for maintaining the procedure for the well rehabilitation procedure.